What veterans should know about common chiropractic care. There are 5 areas that will be covered in this presentation. Cervicogenic costoclavicular syndrome, cervical spondylosis, lumbar facet syndrome, lumbosacral strain, sprain. Okay, let's begin with number 1. Cervicogenic. What is it? Steady, aching headache in the suboccipital and temporal region of the brain. Pain described as steady and aching and may last from 4 hours to 2 days. May encircle the entire head, beginning in the occipital region and moving to the frontal region of the brain. Pain may increase with forward flexion of the neck. What is the cause? There are several different causes for cervicogenic. They include cervical subluxations, partial dislocations of cervical vertebrae, trauma, postural strain, myofascial trigger points, TMJ, temporomandibular joint syndrome, tension, stress, fatigue, noise, and glare can all make the headaches worsen. How can it be treated? First, the case must be diagnosed as cervicogenic. This is done by checking tension of masticatory and submandibular muscles, ruling out TMJ involvement. Look for hyperalgia of skin zones in the cervical region and trigger points on the neck and thorax. Check cervical and thoracic spine, AC joint, and sternoclavicular joint for impaired function. Check for anterior weight bearing. How can it be treated? Once diagnosed, cervicogenic can be treated using the following methods. Massaging of the occipital and paraspinal muscles. Ultrasound of upper trapezius and lower cervical paraspinal muscles, following with moist heat. How can it be treated? Icing the neck. Adjustments of cervical and thoracic subluxations. Check for food allergies and remove those foods from the diet. Valerian root, passion flower, magnesium, and calcium may also help. How long will the treatment take? The length of treatment depends on who is being treated and how severe the headaches are. Treatment length varies from case to case. 2. Costoclavicular syndrome. What is it? Neurovascular compression of the shoulder girdle. Pain is increased by abduction and retraction of the shoulder, as is paresthesia. Pain is most severe during the night and early morning. Effects include pain, numbness, and paresthesia of the neck, upper extremities, and anterior chest wall. What is the cause? Narrowing of the space between the first rib and the clavicle. Compression of the subclavian artery and brachial-plexus. Poor posture, trauma, fatigue, or emotional stress can all be relating factors. How can it be treated? First, the injury must be defined as costoclavicular syndrome. This is done by checking for trigger points around the neck and clavicular region, diminished or absent pulse unilaterally or bilaterally of the neck and clavicular regions, sensory impairment over the regions of C8 to T1, cyanosis, edema, Raynaud's phenomenon, and distal gangrene of the upper limbs. How can it be treated? Once diagnosed, costoclavicular syndrome can be treated using the following methods. Moist heat and ultrasound. Muscle stripping. Stretching of the involved muscles. Trigger point therapy to reduce muscle spasms. Check for impaired function and anterior weight bearing of the cervicothoracic spine, AC joint, and sternoclavicular joint. How can it be treated? Reduce subluxations in the occipital, cervical, and thoracic regions. Posture and shoulder elevation exercises. Stretching of involved muscles. Ischemic pressure techniques applied for 5 to 7 seconds on myofascial trigger points in the cervical, upper thoracic and shoulder muscles. Valerian root, passion flower, magnesium and calcium may help to stop muscle spasms. How long will treatment take? Depending on the severity of the case, treatment time for costochondroplastics syndrome is always different. 3. Lumbar facet syndrome. What is it? Rotational and compression injury of the facet joints in the lumbar spine. Also known as posterior joint syndrome or acute locked back. What is it? Characterized by low back pain that is relieved by motion but aggravated by lumbar extension and rotations, prolonged sitting, and repetitive movements. Pain may move to upper thighs, groin, hip and buttocks. Pain may also move to sacro-iliac joints and superior iliac spine. What is the cause? Trauma, microtrauma. Obesity causing excessive weight bearing by lumbar spine. Decreased disc height. How does IT occur? Increased lumbosacral lordosis, forward curvature of the lumbar spine. Disc degeneration. Poor posture. Tear or pinch of facet capsule caused by hyperextension of hyperflexion of lumbar spine. How can IT be treated? The injury must first be diagnosed as lumbar facet syndrome. It can be identified mostly by the pain it is characterized by, but also by tenderness of the lumbar spinous processes and transverse processes when touched. How can IT be treated? Once diagnosed, lumbar facet syndrome can be treated in two fashions, one for an acute case, and another for chronic or subacute cases. Acute treatment. Icing the lumbar region. Ice massage of the lumbar region. High-volt sinusoidal interferential current. Ultrasound. Subacute or chronic treatment. Moist hot packs. TENS machine used to block pain. Short-wave diathermy. Manipulation. Flexion/distraction and traction. Pelvic flattening and strengthening of the abdominal muscles to correct the anterior pelvic tilt and to flatten the lumbar curve. Subacute or chronic treatment. McKenzie exercises to help strengthen and stabilize the lumbar spine. Proteolytic enzymes, bioflavonoids, and various herbals to relieve acute pain and inflammation. Amino acids, glucosamine sulfate, vitamin C, alpha-ketoglutarate acid, calcium, vitamin E, zinc, copper, and manganese can be taken to help with tissue healing. How long will treatment take? Treatment time varies from person to person, depending on the severity of the case and whether or not it is acute or subacute/chronic. 4. Lumbosacral strain sprain. What is it? Injury involving the combination of stretching, rupturing, or separating the muscles and supporting ligaments of the lumbosacral spine. What is it? Pain is immediate. Pain begins as transitory and is followed by pain-free intervals. Pain is localized to the lumbosacral region but may move to the buttocks and thoracic spine. What is it? Accompanied by stiffness, muscle spasms, and restricted motion in all planes. Pain may worsen with forward flexion. Strains painful with active and isometric movements. Sprains painful in active and passive ranges of motion. What is the cause? Work injuries, sports injuries, car accidents. Continuous use. Microtrauma. Leg length. Muscle imbalance. Excessive foot pronation. How can IT be treated? Before treatment, a patient must be diagnosed as having a lumbosacral strain sprain. The following are signs used to diagnose: slow, guarded gait, analgic posture, tenderness of the involved muscles, spinous tips and transverse processes, edema, joint fixation, tenderness over the paravertebral muscles. How can IT be treated? Lumbosacral strain sprains must be treated in two different fashions, one being for acute cases and the other being for subacute cases. Acute treatment. Ice packs to reduce pain, edema and muscle spasms. Interferential current to manage pain and edema. TENS machine used to control pain. Lumbosacral support. Subacute treatment. Manipulation of locked joints to promote pain-free ranges of motion, prevent fibrotic adhesion, decrease pain, and increase facet joint movement. Subacute treatment. Moist hot packs ultrasound. Electric muscle stimulation. Whirlpool/hot soaks to reduce muscle spasms and relieve tension. Subacute treatment TENS machine to diminish pain. To prevent fibrotic adhesions and to recondition muscle. Muscles may be worked using trigger point therapy, myofascial reliefs, stretching, and massage. Abdominal muscle, low back, and hamstring muscles must be reconditioned using McKenzie exercises and stretching. Subacute treatment. Proteolytic enzymes, bioflavonoids, and various herbals to relieve acute pain and inflammation. Amino acids, glucosamine sulfate, vitamin C, alpha-ketoglutarate acid, calcium, vitamin E, zinc, copper, and manganese can be taken to help with tissue healing. Valerian root, passion flower, magnesium, and calcium and be used to relieve acute muscle spasms. How long will treatment take? Mild strains: 7-10 days. Mild sprains 1-4 weeks. Moderate strains 2-4 weeks. Moderate sprains 1 month, 1 year. Severe sprain strains may require surgery. 5. Cervical spondylosis. What is it? Osteoarthritic changes of the facet joints including the narrowing of space between discs, the formation of osteophytes, sometimes neurological symptoms. What is it? Pain may be limited to the posterior neck or can radiate to the occiput, anterior chest wall, shoulders, arms, and or hands. Diminished ranges of motion in the neck can be associated with cervicogenic headaches. Patient may have abnormal disc degeneration which may cause vertebrobasilar ischemia, ataxia, and vertigo. What is the cause? Cervical strains, sprains, repetitive trauma. Metabolic disorders of articular cartilage. Post-surgical changes. How can IT be treated? First, the condition must be diagnosed as cervical spondylosis. This is most easily done by taking X-rays which will show decreased cervical lordosis, decreased disc height, osteophytosis, osteophytes, posterior and anterior. How can IT be treated? Sclerosis, eburnation of the uncovertebral joints, subchondral osteoporosis, IVF encroachment. How can IT be treated? Once diagnosed, cervical spondylosis can be treated by wearing a cervical collar for the majority of the day for up to 2 weeks to separate the spaces between joints. Cervical traction. Myofascial stripping techniques may be used on involved muscles. How can IT be treated? Ultrasound may be used to break up fibrotic adhesions, reduce muscle spasms, and increase the range of motion of the neck. Adjustments of subluxations in the cervical and thoracic spine. ROM exercises. Trigger point therapy. How can IT be treated? Glucosamine sulfate, vitamin C, iron, and alpha-ketoglutarate acid may be taken to improve the production of collagen. Calcium, vitamin E, zinc, copper, and manganese may be taken to act as free radicals and remove cellular debris and promote healing. How long will the treatment take? The treatment time for cervical spondylosis varies from patient to patient, depending on the severity of the case and how long it has gone untreated. Conclusion. As you can see, I saw a variety of different injuries and treatments while working at Wolf Chiropractic Center. Although not all of these injuries can be prevented, some can. Proper diet, good exercise, and an ergonomic lifestyle can help you prevent some of these injuries. For the people that chose not to do this, there will always be chiropractic care there to help them. but it can only do so much and cannot be expected to work miracles for everyone. This is the end of presentation. Credit to Brian Blunt. For a complete guide to VA disability claims and to find out more about your potential VA disability case and how to obtain favorable VA rating decision, visit va-claims.org. For cases and decisions that could save your VA service-connected claims, visit valames.org, a non-profit non-governmental agency.